old is too old to have a baby?
On your own or with help?
Ooh, that's a good question. Well, you know what? Let's do this. Let's say on your own. There are a lot of women these days that want to do that.
On your own. So basically, this is depressing, but after age 30, your fertility is going to start declining year by year. Okay?
Drastically?
Not drastically, just like a slow decline. At age 40, it's a drastic drop. Okay, so after age 40, you pretty much have a less than 5% chance of getting pregnant.
Naturally.
Okay? Naturally.
Wow.
So that's not impossible. Still, you know, it's still a lot, but it's not as easy as if you were 25 or 30.
Okay.
Okay. At age 42, it's pretty much less than 1%. Okay. And the oldest person that I have seen naturally conceive is 43 that carried to term a healthy baby.
Now, was she a mom before, and does that impact your chances?
It does.
You hear people say, once I got pregnant, it was easier.
It does.
Okay.
We see fewer first-time moms over age 40 than patients that are what we call multiparous or that have had children before. But it's still possible to get pregnant. So we still recommend birth control if you don't want to get pregnant because you're not out of the woods. After age 44, it's pretty much less than 1%. So not impossible, but unlikely.
Mm-hmm.
Now, with assisted reproductive technology, then you can get some help. And I think that their cutoff is age 50.
Okay, wow.
Age 50. Usually you can't use your own eggs over age 43. You have to use what's called donor eggs.
Okay.
So there are young women, they'll pay you for your nice quality eggs.
Ooh.
And
I also, to piggyback on your advice, highly recommend birth control for those not wanting to expand that.
yes.
And my little third baby is, she was the best surprise ever, but it's shocking how that just happens. If you have had endometrial ablation, where they essentially burn part of your uterus, can you still carry a pregnancy?
It is not recommended.
Why is that?
It is not recommended because we have basically burned the lining, which is what the placenta attaches to. And because it's a procedure that we haven't studied what happens, there's so few pregnancies after that, we don't really know what the implications are.
For the baby and the mom?
Just for the pregnancy.
Okay.
Just for whether or not you're even going to be able to implant. Like, is the placenta, is the fetus going to be able to implant the embryo, get in there and grow appropriately? Is there going to be increased risk for miscarriage? Is there going to be problems with growth because your lining is not like what I like to refer to it as lush, like your lawn is lush.
Like a rainforest, a lush rainforest of dense growth.
And so it is actually preferably good medicine to make sure that someone has had permanent birth control before you do an endometrial ablation.
The idea of alternative medicine is huge, so how about this? What are your thoughts on encapsulating and then consuming the placenta?
Thumbs down.
Really?
Yes.
A hard thumbs down.
A hard thumbs down.
Why?
So number one, it's not recommended by the Centers for Disease Control because of infection risk. That's number one.
Interesting. So you could be carrying something in the placenta that would then be transferred back into your system.
Correct.
Oh,
Correct. That's number one. Number two, for me as a medical professional, there is a reason the placenta comes out after delivery and you get a different placenta each time. If you leave your placenta behind, it can cause bleeding, it can cause infection. During the pregnancy, it's the cause of different things like gestational diabetes, preeclampsia, and so your body gets rid of it for a reason. Next, to desiccate it and encapsulate it, there are no known nutrients and there's no known benefit to it.
What about the women who swear up and down that it helps with mood disorders and general well-being?
They swear that. There's no evidence to support that. That's what I would say. With that said, if you want your placenta, you can take it and you can do what you want with it. I don't ever recommend that to my patients.
What, do you send people home from the hospital with placenta in a doggy bag?
If you want your own placenta, we have a red biohazard bag. It is perfectly acceptable and allowed. If people would like their placenta, they are able to take their own placenta home.
Oh my goodness
We just
gracious.
give it to them. They say, I want my placenta. And we say, okay. Take it up and give it to
Enjoy
them and do what you want with it.
Throw it in that Vitamix and go.
And then the concern also with the encapsulation is where you're getting it done. Like if you're going to like a doula or a lay person, are they using the same blender? How are they sterilizing it in between? Like you just don't know kind of what's going on.
Okay.
And there's no proven benefit, so we don't recommend doing it. But that said, people do what they want.
Okay.
Okay. And people are obsessed with woo woo.
Ding, ding, ding.
I'm a doctor, so I believe in Western medicine. For the most part, I tell patients it probably won't hurt you, but it might help.
Right.
But with the CDC coming out about there was an infection, I think either the mother or the baby had the infection because of eating the placenta. They don't recommend it.
Okay. There you go. It's on the record now.
But people do it. People take their placentas home.
Sure. I have all kinds of visual images in my mind right now that are not pretty because I have seen a placenta.
Yes, we literally dump it in the bag, tie it up, give it to them.
Wowie. Okay, so another question is, I've been trying to get pregnant for a year.
Yes.
Is there something wrong with me? And what should I do next?
So that's a great question. So all women are afraid they won't be able to have kids. Everyone is afraid of that. Contrary to popular belief, there is no test that we can do to determine whether or not you can have kids. The only way to know is to try. All right? So if you're under 35 and you've been having sex at your fertile times for 1 year and you have not gotten pregnant, then that is a cause for concern. If you're over 35 and it's been 6 months, that's when you want to come in and you want to get some evaluation. We do an evaluation of your husband's sperm, do some lab work on your hormones, check an ultrasound, do a test to make sure your tubes are open, just to make sure there's nothing else going on. About 10% of couples will be infertile, and about 10% of those couples, we won't ever find any reason why they couldn't get pregnant.
Interesting.
And we have lots of different options. So there's a whole field, a whole specialty dedicated to this.
Right. So you say give it a year of trying.
You have to give it a year. We'll laugh at you if you come in after 3 months and you're like, well, my friend got pregnant on the first try. It's like, that's okay. Like you can
don't hang out with that friend.
Well, you can keep trying.
Yeah.
Some people get pregnant first month, first try. Some people get pregnant 12 months, and that doesn't mean there's anything wrong with you.
And when you're trying, it does seem like
stressful.
The whole world around you is pregnant.
It's stressful, but 80% of couples will become pregnant within 1 year of unprotected sex. Okay. If you wait an additional year, so 2 years, 90% of people will be pregnant.
Wow, good.
It's just patience.
Okay.
It's patience. But sometimes there is something wrong, and sometimes people do need intervention. And so if it's been 8 or 9 months, most people will, start the workup, especially if you're older.
Okay. Thoughts on having a C-section versus risking vaginal tearing with the regular birth?
Oh, absolutely risk your vaginal tearing. I would never recommend for someone to have a C-section solely because they're afraid of tearing. I would never recommend that.
And I mean, let's to put it simply, our bodies are designed to go through the process,
they
right?
They are designed to go through the process. This is America, so you can have what's called cesarean on maternal request or demand. So people can just come in and say, I want a C-section.
And you have to listen.
We don't have to.
Right.
I mean, we can send them to someone else.
Sure.
So we don't have to. But for the most part, we'll do it. I personally try to counsel my patients not to do that. Mm-hmm. I'm very pro vaginal delivery. I, for myself, did not want to have a C-section. I actually did have a C-section. Mm-hmm. That wasn't my plan. Same thing with Sonni. Those things happen. But that wasn't my plan going into it. Right. I wanted to have a vaginal delivery, but it wasn't working out. So that's what happened. So I tell patients, everybody should try, and if it's gonna work, it'll work, and if it won't, then it won't. But don't be afraid to tear.
Well, and let's debunk some of the myths on tearing too.
Sure.
We have this image of like alien crawling out of your body.
Sure.
More often than not, if you've labored slowly, right, the risk of tearing doesn't necessarily have to be tremendous.
It's not a huge tear. I think people hear the horror stories of this hole from your vagina to your butthole. That is called a 4th degree tear. That is rare.
That rare?
That's
like how
extremely
rare?
I mean, less than 1%. I mean, I've been doing this since 2007. I've had, I think, 1 4th degree tear.
That's it.
One. And there's something called a 3rd degree, which is close.
Right.
And I've maybe had 15 of those.
Okay.
And this is out of thousands of deliveries. So it's most commonly that you'll have just a little tear in the vagina and a little tear in what's called the perineum between your vagina and your anus.
And that heals up.
Yeah, we sew it up and it heals and it's no problem. It hurts, but it's not a reason to have a major surgery.
Right. Okay. So
bad.
Only do a C-section if you have to.
If you need to. So what we call standard obstetric indications. So that's why I do C-sections. That's why I had a C-section.
Yeah.
But for patients that come to me, I counsel them that it is ideal if you have a vaginal delivery.
On the topic of C-sections, do you recommend, there's a new trend now where doctors are taking the baby and immediately placing them on mom. Have you started to do that, and what are your thoughts about that?
We don't do it immediately.
Okay.
We do offer skin to skin in the hospital. I deliver at Winter Park Memorial Hospital, and we are breastfeeding champions. So we do the delivery as normal, and we have the baby go to the warmer, and then once the baby's been assessed, if the mother feels comfortable, we will allow skin to skin. Mm-hmm. So it is not a bad thing, and it is maternal choice. Now, we don't have the setup. There are different drapes to have the baby come out and go directly there without disrupting our sterile field.
Right.
So that is not something that we offer, and honestly not something that we get many requests for. A lot of people ask for it in advance, but actually when they're there, don't feel comfortable having the baby. One of the benefits of immediate skin to skin is to improve your breastfeeding success. And so if mothers want to do that, then we encourage that and we try to get the baby latched if they will. Okay. Otherwise, we do it in the recovery room.
All right. Ooh, this is juicy. Okay. So we have readers across the whole age spectrum. And this woman is asking, what would cause a drop in sex drive?
Well, let me tell you, this is a common question
really?
that I get daily.
Wow, okay.
From women of all ages.
And let me say for the record, once you have children,
yes,
you're going to experience a lot of changes.
That's one thing.
Right.
And so the way that I counsel my patients, obviously there's a natural change in your libido based on age. And obviously when you get closer to menopause, your hormones change and that can cause a decrease in your libido. But I have 20-somethings, 30-somethings that are coming in complaining of decreased libido. So the main culprit is birth control. So birth control pills, the patch, the NuvaRing, or really any hormonal contraception could potentially cause decreased libido.
Do you suggest they get off in order to get that back? No.
No. Usually we change methods.
Okay.
And we kind of talk about other things. And so I counsel my patients that for women, sex is mental. Okay? So we have to be in the mindset of having sex. For men, it's physical. So the way, my example, I say for us working mothers, okay, we get up in the morning and we get the kids ready, we get ourselves ready, we go to daycare, we go to work, we got a list. You're like, okay, I gotta go home, I gotta get the kids, I gotta cook dinner, I gotta get ready for tomorrow. 10 o'clock, you're like, yes, I'm in the bed, I'm going to sleep. And your husband's like, let's have sex. You're like, have sex? You're like, not on my list.
If by sex you mean laying here and falling asleep in 15 seconds, then okay.
So one of the things is to talk to your partner and try to kind of let them know where you're coming from. They need to wine you, dine you, give you some foreplay, different things like that. Now, the thing that is a bummer is there really aren't any remedies. Like we don't have any medications that can just, you take this pill and you'll want to have sex.
Have you found though that when you advise your patients to do those things, to pay more attention to the mindset, for example, that it does come back?
For some people.
Okay.
It's kind of, I encourage them to just kind of get over the hump and just like make yourself get into it, but really talking to the partner, making sure they're on the same page.
Right.
Because I think it becomes stressful when the sex drives don't match.
Right.
And so this is a really common question.
That's interesting.
And
okay.
Like I always tell people, I said, if a man can't have sex, they come up with medication ASAP. Women, we're just supposed to
get on that doctor's.
We're supposed to grin.
I know, what's up with that?
That's what they do. That's what they do.
We have to have the babies, we gotta raise them, and now
we're just supposed to lay there.
Okay. I know I said that was the last question, but I'm sneaky today. I did think of one more thing, another topic that I think is really important for moms. Very quickly, if you could touch on when is it important to speak to someone after you've given birth?
Oh my gosh,
yes, and if you feel like you are off, postpartum depression is very common.
Extremely common, postpartum mood disturbance. So common that our governing body, the American College of Obstetrics and Gynecology, is actually encouraging us to see patients sooner, because now we see them 6 weeks after delivery, like 2 weeks, 4 weeks to check on them. So basically, the first 2 weeks, anybody that has a baby, that's nuts. And it's normal to have the baby blues. That's normal. Overall, you should be happy. You should not be feeling like hurting yourself or hurting anyone. What's most common is postpartum anxiety, and people are just so nervous, and some of it's normal and some of it becomes pathologic, and then it really starts to bother you. I've had husbands call. I've had patients come in. Like husbands say that she's not right. Like you shouldn't be overall tearful. Like you should want to be happy. So if you don't feel right, always come in. Right. We're very, very, very happy to see you. Usually we'll get you in the same day. We offer services for therapy. We get you referred to the right person and or medication if needed. It can happen up to 1 year after delivery.
That's so important to know.
So it's not just right away.
Right.
Some people just expect it to keep going away. Some people are reluctant to do medication, but it's important. Most of the time, it's just going to be postpartum depression, which is a big deal, and it's not going to morph into something called postpartum psychosis, which is where you read on the news and someone kills their kids.
Right.
But that's a big deal. So that's what we're screening for. So it's a huge deal.
Right. Well, I appreciate you being so candid about that,
No
because
problem.
that is something that we have,
it's
mothers,
brushed under the rug.
Right. We don't really have the opportunity to talk about it.
You're just told to suck it up, and everybody does it and you get through it. But some people can't make it. And some people are so anxious they can't leave their house. They don't want anybody else to drive their kid. They don't want anybody else to watch their baby. So some people don't want to be around their baby, and other people, they hover, and it's affecting their life. So that's when you should seek seek help.
Always call. Well, you are the greatest, Dr. Warren.
Thank
you so much
Thanks
for doing
having
this.
Me.
All right, guys. So we'll link all of the important information and comments below. Location to Dr. Warren's office, as well as all the resources that she mentioned. But happy baby making. And if you have any other questions,
let us know.
Yeah, let us know. Feel free to comment below. See you guys.